Morning, ladies and gentlemen. I will call the Nevada Board of Examiners meeting to order. The Secretary of State is present in Las Vegas and the Attorney General is excused. Madam Secretary, can you hear us loud and clear in Las Vegas?
Yes, Governor, we can.
All right, thank you. We'll move then to agenda item number 2, public comment. Is there any member of the public present in Carson City that would like to provide public comment to the board? I hear and see no one. Is there anyone present in Las Vegas that would like to provide public comment?
Yes, there is a gentleman sitting at the table, Governor, that would like to give some public testimony.
Okay. Good morning, sir. If you would please identify yourself for the record and spell your last name, please.
Oh, I hit it right. There we go. Good morning, Governor Sandoval. My name is Malcolm Laverne, and to please you and Madam Secretary, I am one of the Las Vegas Dental Association attorneys and would like to read this statement to you today. I provided 3 copies with the exhibits. You were kind enough to listen to us at the last meeting, and we appreciate that you have since appointed 4 new dental board members. There's documented evidence of the misappropriation of approximately $140,000 by the board members, specifically Drs. Pisani, Champagne, Penther, and Blasco, for their own personal and proper use. Quoted directly from the dental board minutes, board counsel, or then board counsel, John Hunt, said that the licensees that stipulate to choose voluntarily make donations to different public health programs in lieu of some discipline or charges. That's Exhibit 1. What Mr. Hunt did not mention was that these licensees donated $70,000 to Pisani, Penther, and Champagne's organizations in lieu of discipline or charges. Board member Pisani is the president of this organization, which is called the NNDHP. Champagne and Penther are directly involved, and Kathy Champagne is one of the directors. First, these donations were ruled illegal by the legislative auditors. Second, these board members did not disclose to the auditors that the money went to the organizations. And third, these board members knew that the organizations were not public entities but private. As a note, we are only bringing forth the matters that are relevant under the jurisdiction of this committee. Then Board Counsel Hunt stated that all board members are selected from the Nevada Dental Association. When you connect the dots, NNDHP's Adopt the Vet program is encompassed under the NNDS, which is a component of the Nevada Dental Association. There's also exhibits attached supporting that in 2, 3, 4. 2 dentists called the executive director of the board to report an unlicensed hygienist who was working at their practices. Rather than thanking these dentists for reporting the hygienist, these board members selected from the Nevada Dental Association charged the 2 dentists for unknowingly hiring an unlicensed hygienist. As punishment, these 2 dentists had to sign stipulations to pay donations of $100,000, of which $50,000 went to board members Pisani, Champagne, and Penther's organizations. It is improper to force a dentist to pay a private organization money in lieu of discipline or charges. It is even more improper when there is a conflict of interest because these dental board members are part of and control the organization receiving the donations. This type of self-dealing using the state board powers to extract donations is, at the very least, unethical. Pisani, Champagne, Penther, and Blasco had full knowledge that this money was going directly to this organization because they voted to approve the stipulations against these 2 dentists, which said that they had to pay the money directly to Adopt the Vet. That's supported in Exhibits 5, 6, and 7, and 8 signed stipulations with donations. What makes this more reprehensible is that the only legal way to charge this money was through fines, which failing to deposit this money into the state general fund would be a violation of NRS 631.354, subsection 4. However, this was impossible because the 2 dentists had to pay had to pay attorneys and investigation fees to the board in the amount of $6,250. These board members or the executive director, Schaefer, has returned the $140,000 to these licensees. The executive director, Schaefer, oversaw Pisani, Champagne, Blasco, and Penther vote for a 3rd investigated dentist to send money to Adopt the Vet organization while they simultaneously voted to reward Schaefer with a $10,000 bonus because of her diligence in creating so much income from disciplining dentists. That's in the board minutes, Exhibit 9. The state dental board disciplinary process has turned into a profit-making center to incentivize bonuses and pay increases for board staff. Secretary and state of records, board minutes, and legislative audit records clearly show that these board members and the executive director shared in the profits from either overcharging or improperly charging investigative licensees. Deborah Schaefer is the very same executive director that the legislative auditors caught overcharging 50% of the investigative licensees for costs of the investigation. That's Exhibit 10. This would explain why board members Pisani, Champagne, and Pinther continue to retaliate against anyone who questioned their flawed disciplinary process. We believe the investigated dentists have not asked for their money back. The official in this state that has a statutory mandate to remove board members from this dental board for incompetence or dishonorable conduct under the provision of NRS 631.150. Please consider all the facts brought forward today, and if necessary, call my office, law office, if you require any additional information. Thank you.
Thank you very much.
I appreciate it.
Is there any further public comment from Southern Nevada?
Anybody else?
Thank
No,
you.
Governor.
Thank you, Madam Secretary. If you would make sure that we have copies of those letters that were read into the record and the exhibits, please. For the construction of this beautiful clock that is now part of the old assembly chambers. It's the final piece, but this was handmade. We'll move to agenda item number 3, which is approval of the October 9, 2018 meeting minutes. The minutes of the meeting of October 9 says 2-0. We'll move to agenda.
There are 6 requests for 8 vehicles on this agenda item. The first request is the department budget. The second request is from the Department of Agriculture, Division 18, U.S. Department of Agriculture grant funds. The third request funded with repair and maintenance savings from the vehicle being replaced. The fourth request is from those included in the agency's legislatively approved budget. The vehicle was included in the agency's legislatively approved budget due to a change in requirements in commission to purchase 3 replacement vehicles from the highway departments. Are here to answer any questions the board may have.
I move to approve the requests to purchase state vehicles as presented in agenda item number 4. I second the motion. Any questions or discussion? All in favor say aye.
Aye.
Aye. That motion passes 2-0.
Contract with current and/or former employees pursuant to NRS 333.705, subsection 1. The first request is from the Department of Administrative Services Division to contract with a former employee to provide training to new employees. The employee retired in October of 2017. The second request is from the Department of Health and Human Services, Aging and Disability Services Division to contract with a former employee to administer direct care staff training in behavioral safety. The employee retired in December of 2017.
None, Governor. Move for, well, I'll wait till B. Did he do A and B or just A?
He did both.
Okay, then I'll move for approval. I'm sorry, I just remember hearing about the one, so we'll move for approval on both A and B of 5.
Thank you. Secretary of State has moved to approve the authorizations to contract with a current and/or former state employee as presented in agenda item 5A and B. I second the motion. Any questions or discussion? I hear none. All in favor say aye.
Aye.
Aye. That motion passes 2-0. We'll move to agenda item number 6, request for approval to pay claims from the stale claims account. Mr. Nix.
Item 6 includes 2 requests to pay late invoices pursuant to NRS 353.097. The first request is from the Department of Health and Human Services, Aging and Disability Services to pay $58,832.75 to All Valley Home Care for personal care services. The invoice was received by the department after the cutoff for processing of fiscal year account. The second request is from the Department of Health and Human Services, Division of Child and Family Services, to pay an incentive payment of $98,876.60 to the Clark County Department of Family Services pursuant to NRS 432B.2165. The report was received by the department prior to the statutory deadline for the incentive, but there was not sufficient time to review the report prior to the cutoff for processing fiscal year 2018 transactions. Funds in this program did not balance forward, and the department did revert sufficient funds to cover the cost of this claim. The claim will be paid from the stale claims account. Representatives from the departments are available to answer any questions the board may have.
Thank you, Mr. Nix. I have no questions. Madam Secretary, any questions?
Yes, I think the numbers that Mr. Nix gave were different than what's on our agenda. I just, for the record, need to make sure, because when I was reading along, it didn't, the numbers weren't correct.
All right, we'll check. Thank you, Madam Secretary. Good catch.
Thank you.
That is correct. The actual amount should be $93,187 for the Department of Health and Human Services, Division of Child Care and Family Services, Clark County Child Welfare payment, which was agenda item.
I'll move for approval, Governor.
Thank you, Madam Secretary. The Secretary of State has moved to approve the requests to pay claims from the stale claims account as presented in agenda items 6A and B. And those amounts, Mr. Nix, are correct, the 58,832.75 and the 93,187, correct?
That is correct.
All right. I will second the motion. Any questions or discussion? All in favor say aye.
Aye.
Aye. That motion passes 2-0. We'll move to agenda item number 7, which is a request for approval to pay a cash settlement. Mr. Nix.
Item 7 includes a request for approval of a cash settlement from the Department of Transportation relating to the Project Neon in Las Vegas. The request in the amount of $475,000 will fully resolve an eminent domain action. Approval of the additional amount will bring the total settlement to $642,000. Representatives from the Department of Transportation are available to answer any questions the board may have.
Thank you, Mr. Nix. Director Malfabon, Mr. Gallagher, good morning. Please proceed.
Good morning, Governor. Good morning, Madam Secretary. My name is Rudy Malfabon. I'm the Director of Nevada Department of Transportation. With me is Dennis Gallagher, our Chief Deputy Attorney General. NDOT is seeking approval of a settlement for a condemnation action related to Jackson et al. We required acquisition of a portion of the property and a temporary construction easement so that our contractor could build a portion of Project Neon. It was along Martin Luther King Jr. Boulevard in Las Vegas. As was mentioned, we required only a portion of the property. About 1.45 acres was the entire parcel. We needed about, 1.17 acres remains with the property owner. We received approval from the Transportation Board to condemn the property to acquire it because we couldn't come to terms with the landowners. Subsequently, the owner felt that NDOT had impacted the value of their property because of the uncertainty of their plans. They said that NDOT affected their plans to develop it, build an office building on the property. We went to district court, and we are at the point where we actually won in district court on the issue of the largest portion of their claim on inversely condemning the property over $1.2 million. However, there was the concern from the department. They were seeking over $2 million in the property value and damages and the temporary easement costs and severance damages to the property. So we felt that this settlement, which requires an additional amount of money of $475,000 in new money in addition to what we had previously deposited with the court, so a total of $642,000 to settle this case, is in the best interest of the taxpayers and the department. Dennis Gallagher is here to answer any legal questions. He has some staff in Las Vegas also that can get into any of the details for questions from the Board of Examiners.
Okay, thank you, Director Malfabon. Mr. Gallagher, anything that you wanted to add? I had a couple questions and comments, but usually you anticipate those, so why don't you go ahead and provide a statement, please.
Good morning, Governor, Madam Secretary. For the record, Dennis Gallagher, Chief Counsel for the Nevada Department of Transportation. Governor, hopefully I'll be able to anticipate all your questions. The state's exposure in this matter is over $2 million. The $2 million in claim damages, plus we would have the obligation, since it's a direct condemnation action, to pay reasonable costs on the other side, which would be another $50,000 to $100,000. So this settlement's less than a third of the state's exposure. This case has a long and tortured history, starting with a condemnation resolution that was later rescinded because of a change in design, removal from state court to federal court because of the federal tax lien, remand back to the state court. As the director alluded to, the largest portion of their claim is approximately $1.2 million in pre-condemnation damages, which we won below, but property owner has filed for writ of mandamus on that particular issue. This proposed settlement, which seeks an additional $475,000 in new money, would dismiss the appeal in its entirety, dismiss the remaining actions below in the district court, and allow an entry of a final order of condemnation. So basically, it'll take this matter and completely close it out on all levels. And given the dollar amount and the potential exposure, it's felt that this is a reasonable settlement for both the general public and taxpayers on the one hand, and the property owners on the other hand.
Thank you, Mr. Gallagher, and well done. I just wanted to ensure that it was a dismissal with prejudice. Both parties walk away and we are done. And also, not only have we avoided the risk of the attorney's fees associated with the action up until this time, if there was a unfavorable decision by the Supreme Court, there likely would be a remand and you would have to retry the case again. Is that accurate?
That is correct. If a writ was entered, a trial has not been held on the various issues, so the property owner would be able to present to a jury its rationale for a claim of pre-condemnation damages on this piece of property.
Thank you. And I think this is an excellent result, and I think you did say it's in the best interest of the state to accept this settlement.
I did, sir.
Yeah, thank you. Madam Secretary, any questions with regard to agenda item number 7?
No, thank you, Governor. I'll move for approval.
The Secretary of State has moved to approve the request to pay a cash settlement in the sum of $475,000 as presented in agenda item number 7. I will second the motion. Any further questions or comments? There are none. All in favor say aye.
Aye.
The motion passes 2-0. Thank you, gentlemen. Agenda item number 8 is a request for a recommendation of approval to the IFC for an expenditure from the Fund for New Construction of Facilities for Prison Industries. Mr. Nix.
Pursuant to NRS 209.192, the Department of Corrections Prison Industries is requesting access to $233,315 from the Fund for New Construction of Facilities for Prison Industries. Funds in this account can be used to house new or expand existing industries, to provide additional employment for offenders, to relocate, expand, upgrade, or modify existing industry to improve operations, security, or to provide additional employment or training of offenders, to purchase or lease equipment for training or operating the industries, to pay for operations of prison industries, or to advertise or promote goods produced or services provided by prison industries. Expenditures packet contains a list of proposed expenditures, and representatives from the department are available to answer any questions the board may have.
And thank you, Mr. Nix. Mr. Quinga, are you here for this agenda item? Let's lay a little more specifics as to where the money will go. I think it's a good program, but please proceed.
For the record, Bill Quinga, Department of Corrections, Silver State Industries. I also have Diane Dastel as the Chief of Fiscal. I'll have her go ahead and start.
Okay, I'm Diane Dastel, ASO of Prison Industries. Our ranch is requesting feeder steers, a barn relocation, and game birds. We have our garment factory. They would like to, keep up with the demand of their goods. They're requesting a cover stitch flat machine, chairs and sewing stations for these machines. and the additional offenders that will need to work this stuff. Our auto shop is requesting a plasma cutter, a MIG welder, a TIG welder. They also have outdated computer equipment. Our mattress factory is in need of a tape edge head machine, a sewing machine, and a box spring binder machine. Heavy-duty Mortise machine, a saw stop cabinet saw, a Raleigh box and pan brake, actually I'm into metal. They wanted the Raleigh box. They also want a full pin pep plate, a TIG welder, pressure abrasive blaster, roller conveyors, a air compressor, and a welding gun. And this all totals $233,315.
Mr. Quenga.
For the record, Bill Quenga, in request for all this equipment, this is to enhance our program and to hire more offenders, to put them to work, give them more skill, obtainable skills, marketable skills upon release.
Any positions this would, or openings it would create for more, as you say, more opportunities for offenders?
For the record,
Piece. What is that in terms of, would you acquire more steers? Is that what that says? Or what would they be doing associated with that?
for the record, I'll have Justin Coke, the manager here, but we are trying to enhance our feeder steers to increase the head count out there and provide more jobs at our ranch and dairy operation.
And just out of curiosity, where does that beef go after we've raised it?
For the record, Bill Quenga, we send them up to the Fallon, I believe the Fallon auction up there. Oh, okay. Stays in state.
Wonderful. Madam Secretary, any questions?
Yes, Governor, thank you very much. Just to make sure that I'm understanding everything that you're asking for, it's not just for the Carson City facility. You're looking at the list that you've provided us with it being statewide. Can you tell me how many locations you're looking at? I know that, do you do most of the mattresses in Las Vegas, or are those all in Carson?
For the record, Bill Quenga, the mattress factory is in Carson City. Garment factory is up in Lovelock, and then the auto shop is down at Southern Desert, down in Indian Springs.
Okay, so there's a combination for these three that you need at these three different locations, correct?
For the record, Bill Quenga, yes, that's correct.
Okay, thank you. Governor, that's all I have, and I'd move for approval of number 8.
Thank you, Madam Secretary. The Secretary of State has moved to approve the request for a recommendation to the IFC Committee for an expenditure from the Fund for New Construction of Facilities for Prison Industries in the sum of $233,315. I second the motion. Any questions or discussion? I hear none. All in favor say aye.
Aye.
Aye. Motion passes 2-0. Thank you, Mr. Quenga. We'll move to agenda item number 9, which is request for recommendation approval to the IFC for an allocation amount from the contingency account. Department of Education, Department of Public Safety. Mr. Nix.
Item 9 has your request for a positive recommendation to the Interim Finance Committee pursuant to NRS 353.268. The general fund contingency account has approximate balance of $7.6 million to cover unanticipated costs for the remainder of the 2017 to 2019 biennium. If these items are approved, the remaining balance of the account will be approximately $7 million. The first request is from the Department of Education, Special Education Contingency in the amount of $114,425 to replenish the Special Education Contingency Fund. The second request is from the Department of Public Safety, Parole and Probation Division in the amount of $457,308 to fund the entire general fund portion of the 2019 cost for the Nevada Shared Radio System upgrade. Representatives from the department are available to answer any questions the board may have.
Thank you, Mr. Nix, and I'm very familiar with the second item on there and have no questions with regard to the first item. Madam Secretary, any questions?
No, Governor, no about both of them as well. Thank you. And move for approval.
Secretary of State.
Item 9.
Oh, I'm sorry. Go ahead.
I was just going to say on 9, I sometimes fail to tell you which one.
No, thank you. Secretary of State has moved to approve the request for recommendations to the IFC for an allocation amount from the contingency fund from the Department of Education in the sum of $114,425 and the Department of Public Safety in the sum of $457,308. I second the motion. Any questions or discussion? There are none. All in favor say aye.
Aye.
Aye. That motion passes 2-0. We'll move to agenda item number 10, establishment of schedule of daily resident rates for the Department of Veteran Services Northern Nevada State Veterans Home. Mr. Nix.
Pursuant to NRS 417.147, the State Board of Examiners shall establish a schedule of rates for occupancy of rooms at each veteran's home in the state. The Director of Veteran Services has submitted the following rates for the Northern Nevada Veterans Home: $173 per day for veterans and $280 per day for spouses and Gold Star family members. Representatives from the department are available to answer any questions the board may have.
Thank you, Mr. Nix. I had my questions answered previously, but I just want to say on December 17th, we're going to be doing the ribbon cutting for the Veterans Home, and for all of you that can be there, I really encourage you to attend. It is going to be a monumental day in the history of services to our veterans, and it is going to be a facility that is as good or better than any facility in the United States of America. I had the opportunity to be out there not long ago. We've renamed the street to Battleborn Way, thanks to the city of Sparks. And Veteran Services, Wendy, I want to compliment everybody who's worked so hard and the contractor. I'm being a little redundant because these are some of the things I'll say that day, but this is, given that we're coming off Veterans Day weekend, this is going to be a really wonderful facility that's going to serve our veterans and give them, what they deserve. So again, my sincere thanks, and this is a part of that process by which we can get the facility open and approve the rates, but it is truly going to be something special. Madam Secretary, any questions or comments?
Yes, thank you, Governor. I really appreciate that. I had the privilege of touring the facility as they're finishing it, and I have to tell you, Wendy and everybody needs to be commended. It is wonderful. You, Governor, for the vision and for getting everything started in the north. The only question that I have that I haven't had an answer to is, how does someone that is a Gold Star family member or spouse, how do they go about getting involved or being able to come to the Veterans Home? Is it the same type of application? That's my only question that I really have about that. And then just our rates, how they can.
Please proceed.
Let's try one. Got me? Thank you. Usually I'm very good with mics, Governor. Madam Secretary, thank you for the questions. Governor Sandoval, thank you for your kind words. We all are standing so excited for this. And in answer to your first question, for the record, Wendy Simmons, Deputy Director, Nevada Department of Veteran Services. The application process for a Gold Star family member is just evidence of the service members' DD 214, and that will now make them eligible. With regard to the question relative to the rates, it's $150 a day, and for a spouse, it's $212. In the new Northern Nevada Veterans Home, all of the accommodations, the average rate in Northern Nevada is $315 a day for private pay. This is why we felt that we could hold at $173 per day and $280 for the spouse and meet the obligations that we would have to these folks.
Governor, if I might, I just want to thank Wendy and her team so much for what they've done, and I did want that on the record because that really means a lot to these veterans with the amount of income that they get. It just really means a lot, so I'm really grateful for the consideration and the thoughtfulness that this group put together and looked at to make sure that they could afford to stay. So thank you for letting me say something, and Wendy, you and your team, just outstanding, and I look forward to the ribbon cutting. Thank you.
Madam Secretary and Governor.
And Ms. Simmons, if I may, I do have one question. The Secretary's questions prompted. So how are we doing? Is it full? Is the home fully subscribed now, or are there still openings?
For the record, Wendy Simmons, Deputy Director, Nevada Department of Veterans Services. We currently have 155 individuals on the interest list, and we have a 96 resident capacity. For the actual admission, of course, at the time of request, once we receive our initial licensure, CMS certification, and then our VA certification, the residents have to be pre-screened. I think it's a veteran apartment. We're working very hard to educate everybody that it really is meeting a medical skilled nursing need.
Thank you very much. Madam Secretary, anything else?
Just my gratitude and thanks to everybody involved in this. And again, Governor, thank you for your vision on this. But I move for approval of number 10, establishing a schedule of daily resident rates for the Department of Veterans Services, Northern Nevada State Veterans Home.
Thank you, Madam Secretary, for the motion. I second the motion. Any questions or discussion? There are none. All in favor say aye.
Aye.
That motion passes 2-0. Next is agenda item number 11, approval of proposed leases. Mr. Nix.
There are 10 leases on agenda item number 11 for approval by the board this morning. No additional information has been requested by any of the members.
Any questions, Madam Secretary?
None. Move for approval of number 11, approve the proposed leases.
Thank you, Madam Secretary. The Secretary of State has moved to approve the proposed leases as presented in agenda item number 11. I second the motion. Any questions or discussion? There are none. All in favor say aye.
Aye.
Aye. That motion passes 2-0. We'll move on to agenda item number 12, approval of proposed contracts. Mr. Nix.
There are 45 contracts in agenda item 12 for approval by the board this morning. Members have requested additional information on contract number 4 between the Department of Health and Human Services and Washoe County Human Services Agency, and contract number 23 between the Department of Health and Human Services Division of Public and Behavioral Health and Leah Lamborn, doing business as Creative Consulting Solutions.
Thank you, Mr. Nix. Let's proceed with agenda item number 4, please.
Good morning. For the record, I'm Dr. Julie Gachiva from the Department of Health and Human Services. This contract is a lease, essentially a lease, between the Department of Health and Human Services and Washoe County for buildings located on our Northern Nevada Adult Mental Health Services campus. These buildings were originally built to provide cottage-style institutional placements, but in 1999, with the Olmstead decision, we could not continue to serve people in an institutional setting, so the people were integrated into the community in appropriate settings. But the houses, essentially the cottages, still existed. They were not rehabbed. They still have kitchens and bathrooms. We converted them, semi-converted them to office space without doing a lot of rehabs, and left state employees working in them until either the buildings fell into disrepair, making it not safe for state employees to be there, or the need was no longer needed for that space. The Olmstead decision further precludes the state from housing people on the campus of an institution, and there is still the Deanie Townsend Hospital, Lakes Crossing, and also on the campus, the new Veterans Home, on a campus with an institution. So we cannot, since we use federal Medicaid funding to support our people with disabilities and people who have mental illness, we could not use these cottages to continue to house people even currently. So we have been working with Washoe County and the other jurisdictions to try and find a solution to meet community needs and to use the asset of vacant buildings on our campus. And Amber will go through in detail more of what the plan is. But there are significant savings to the state that we wanted to bring up, even though we're not charging them rent. For example, Washoe County will be providing 24-hour on-site security. That is a value of $6.5 million over the course of the lease. They will also be paying their utilities, which over the course of the lease will be over $1 million. We are not paying for building maintenance, sorry, Amber, for the buildings that we had planned to, which was a $2.2 million savings in deferred and other maintenance. Additionally, a lot of the buildings require a significant amount of rehabilitation as well as asbestos abatement, which we're estimating would be likely up to $10 million to rehab those buildings to bring them back into current use. There are also significant savings to this system as a whole. These are vulnerable people we're intending to serve. The U.S. Interagency Council on Homelessness estimates that it costs $50,000 per person who is vulnerable to remain homeless for the entire year. This is system cost to the healthcare system, local jurisdictions, jails, prisons, psychiatric hospitals, and there were 1,200 seniors, women, and children who were served in Washoe County who were homeless last year. That's up to $60 million in cost to the system that could be diverted or prevented by providing a more comprehensive solution.
Good morning, Governor and Madam Secretary. My name is Amber Howell. I serve as the Washoe County Human Services Agency Director. I'm going to go through a little bit about how we got here today and what we hope to accomplish. Thank you so much for allowing us to present this proposal to you today. First, I just want to go over the capacity of Washoe County's homeless population and census. There is a facility on the Record Street campus in Washoe County that...
Maybe we'll pause for a moment. We have a little bit of static or feedback. Is there a way to correct that?
We don't have any up here, Governor.
Ms. Howell, why don't we forge ahead, and I apologize for interrupting you, but I just want to see if we can quickly fix that.
Okay.
Please proceed.
What we have on the campus at Record Street is a population that's really mixed between different genders and age groups. We have the men's shelter, women are on the campus. There's an overflow, which isn't really an overflow anymore because it's always full due to our census increasing. And then we have family members on the campus, as well as postpartum women who are about to deliver or have just had brand new infants. This is where it's located at, and just to give you an idea of what it looks like. This is the campus that has the playground at the shelter. This is one of the areas that Washoe County was looking at significantly on ways to improve a more child-friendly environment and area for children of small ages. As you can see, it has wrought iron gates. On the outside of that is the outside of the building, lots of people walking by, children witnessing and hearing things that we would rather them not be privy to. And it's not really secluded in an area where we would like them to be as far as daycare. We did a significant data analysis before we approached the campus, looking at what were some of the reasons that our census was increasing and some of the problems we were having with the homeless population, and what would be needed to overcome some of those obstacles. No surprise, of course, as the cost of housing is increasing, lack of income. There's a significant need for us to increase health, mental health, and addiction services in Washoe County. No family or support system or a transient runaway population that's ever growing. Our Crossroads program is something that we wanted to continue to expand. Crossroads in Washoe County is a tiered housing program that really provides housing and food first, and then wrap services around them depending on their needs. Washoe County started this back in 2011 and has served over 1,200 individuals. We have learned that people need a roof over their head and food in their stomachs before they can start focusing on things that they're challenged with We've had tons of success with the Crossroads population, but one of the areas where we are lacking bed capacity is specifically on the women's side. We have a wait list of 165 women waiting to get into the Crossroads program. We'll talk a little bit about how that impacts the child welfare system in a little bit. Some of the challenges when we started looking at the data and the demographics is there's Medicaid eligible individuals there not billing Medicaid or having certified Medicaid specialists that can help in that effort. Of course, the lack of substance abuse and mental health. There's low incentive for them to make positive decisions. They are continuing to collect income and SNAP benefits and don't have to utilize those while they're in the shelter. Children, of course, need a more secure place for them to be at any given time. There's some ongoing drug use that's happening on the campus, and of course, commingling of populations is starting to be a significant challenge for us. And we've also recently learned that our mobile outreach safety team, which is our mental health outreach team in Washoe County, their #1 response location is actually the shelter in Reno. They go there about 3 times a day. And so that tells us there's a significant need of services that we need to increase, and it's also REMSA's #1 place. So anytime you're using those resources for one campus, you're taking away the needs from the rest of the community, and so that's something that we need to take a look at. And then sex trafficking is becoming an issue all over the state, but it's also very prevalent at the shelter. This is the demographics that was specifically of interest to Washoe County. Over 2,600 individuals had frequented the shelter last year. One of the areas of big concern for Washoe County is the number of children that have spent at least one night, that's an unduplicated count, spent at least one night in the shelter. And probably more concerning for us is that 42% of them are under the age of 5. And so that really was very telling for us on areas that we needed to focus to provide a more child-friendly, family-friendly location for those individuals. The census, as I mentioned before, has continued to increase. It's about a 60% increase within the shelters that we saw in a very short period of time for all of the reasons that we mentioned before, but the housing crisis is also a factor. When we started looking at what is it that needs to be built and how do we change the dial on the reason people are ending up in homelessness, we looked at a couple of different areas of their conditions upon entry into the Record Street facility and then what they were challenged with when they left. And as you can see, there hasn't been a lot of change from entries until exits. So this is an opportunity for Washoe County to start infusing services to change the dial on these areas. Of course, alcohol and drug abuse, physical ailments, those types of things, we need to start having a more targeted approach to address those. And if we don't, we will continue to have a revolving door in Washoe County through the shelter, and we'll need to continue to increase bed capacity for the homeless population. This is also what we consider an opportunity slide. This tells us that 55% of the residents at the shelter have SNAP or food security benefits that can be used if they had another place to reside other than the shelter. Also, 58% of them have an income, so that's also an opportunity for them. If they have food security and have some income, if we could put them in a better environment and address some of their issues, perhaps we can change the cycle of homelessness for those individuals. So that's a very important statistic for us to center around. So we're here in front of you today because we started looking at some buildings at the NAMS campus as a way to start separating the populations that we would like to relocate over to the campus, but also what was already existing there. The River House is our Crossroads program for women that's already on the campus. We have our TADS program, which is our temporary assistance for displaced seniors due to being evicted or services mental health campus, and so it was a nice complement to the populations already existing there, rather than looking at whether the men could be relocated from downtown Reno and placed in this campus. So we combed through all of these buildings, and the benefit of these buildings is that they are residential, as Dr. Kachiver mentioned, have bathrooms, kitchen areas, very home-like environments. There is a building 604 that has been tagged for postpartum, which allows us to double the amount of women who are pregnant or have recently had a child to be in a facility all on their own that's very safe and secure, with services wrapped around to help them with their parenting and caring for their child. We will be able to relocate the families at 8C. And then we have our women who would also be able to be relocated to this campus as well. That's about 50 women, but that could be expanded to about 75 with the space that's available there. And find themselves in a homeless situation. They rarely go to the shelter for a variety of reasons. Usually couch surfing. There's about 600 individuals in Washoe County that have been deemed to be homeless, and this space would provide 75 beds for them with wraparound services to get them out of couch surfing on the river and really start working on some of their challenges so that they can have a better future. They're very young, and that's an opportunity to help them. 2 more buildings, the cottages, the 3 up by the south of North Street, would expand our Women's Crossroads. Allowed us, they have donated $75,000 per building to rehabilitate those buildings, which is such a gift for us and allows us to double the population for those ages and genders. And then finally, one of the buildings there, Senior Daybreak 2A, we have a building for Alzheimer's and dementia patients at our Washoe County complex that can only serve 22 individuals who have Alzheimer's and dementia at any given time based on the capacity. And this building is perfect to expand our Daybreak program, which will allow us to triple the amount of people that we can serve. Washoe County is actually the 3rd fastest growing city in the nation right now to serve those populations. So this campus really affords us an opportunity to have some complementary populations and age groups with the people already there, but also allows us to significantly increase the amount of people that we can all be centralized in one place. Some of the expected goals that we're hoping to achieve is to separate the populations, of course, implement a more targeted approach by desegregating some of the populations and allowing them to start focusing on the challenges that they're faced with, expands our Crossroads program, but also provides some significant rehab to the buildings on the NAMS campus. Some of the things that we would like to do at the NAMS campus, of course, is to increase mental health and substance abuse services, to have a robust intake process so you know right from the beginning what it is that the individual is faced with, so you can start developing a more targeted case plan, provide some more stability for them. This can increase the amount of children that are placed in foster care if families can be placed together and work on some of their challenges so that children don't have to be removed from their parents. And finally, I'll close with, there are several benefits to the state to have us locate ourselves on the Washoe County or on the NAMS property. We're going to provide, if the proposal is approved, increase the security through the campus for all populations. So this will help ATC, Denny Townsend, Lakes Crossing, and some of the other staff that are on that facility already. It will, of course, enhance the synergy and complement the populations that are already there. It will reactivate the current vacant facilities that are in need of rehabilitation. We have an architect that has gone out and analyzed some of the initial redesigns that would have to happen on the campus. It's about at least $4.5 million that Washoe County is looking to invest in these properties, from anything from asbestos abatement, things that Dr. had mentioned, flooring, all new paint, really significantly rehabbing those buildings, and then allowing more, we'll take over the landscape and maintenance and really revitalize the campus. It is an excellent space. for this population, and we'd like to be a part of trying to rehabilitate and make the campus better for the state and for local government. So that's the proposal that's in front of you today, and what we would like to do with the current crisis that we're having in Washoe County, and we just appreciate you taking the time to listen and allowing us to explore this possibility. Thank you.
Thank you, Ms. Howell, and I really appreciate your presentation. I mean, this has been a long-standing issue for decades, and this is a perfect example of collaboration between local and state government. The state has an amazing resource and buildings and grounds that are now available. It's always been my hope that they be utilized to their highest and best use. The county brings along a significant amount of resources, as you say, to rehab this, but at the end of the day, this is about people, and people that are struggling and need some help, and this is a perfect place to get that done. It is the proverbial win-win for everybody, and so that, again, you've covered it all in here. So I appreciate you bringing this to the state's attention and creating this opportunity and rehabbing this place that has a long history to a position where we can serve all these children and families. And when you look at some of these pictures and you see where these kids are and you know, all the others, I just am really excited about what is going to happen here. So my compliments to you as well as the County Commission for dedicating this amount of resources. Suppose my only question is you've said that you've hired an architect and there's some significant investment that has to be done. When would you anticipate completion of this rehabilitation and full use of the site?
Amber Howell for the record. Governor, our initial discussions have been that by this time next year we should be open.
And then, you know, and you said this in your presentation, but it obviously opens up beds and resources downtown for the men, and I think this is another good thing, as you said, in terms of safety for children and mothers and single females, etc. Will the openings that are created downtown Reno be able to take care of all the individuals that need assistance, the males that need assistance there?
Amber Howell for the record. Governor, what we are finding is we have a overflow shelter that is 60 beds that we have to open, or a tent that we have to open every winter. And what we're doing is start screening them for the Crossroads program. They are super utilizers of the system, and we need to provide Washoe County staff in there to start sending them through the pipeline of the Crossroads program, so we hopefully don't have to build additional beds. We have to expand our program.
That's correct. Julie Kachiver for the record. So we have been doing a similar discussion and analysis for Las Vegas with Clark County and the city of Las Vegas. The SNAMS campus was also, and NAMS campus, thank you very much, Governor, were included as opportunity zones. And so we keep dangling that out there. SNAMS campus looks a little bit different. It doesn't have as much residential buildings, but it does have open land. And so that's the discussion we've been having with the county, is that while we may not have buildings that you can rehab and move into, there's a lot of open space. Does that make sense to use? We think that there's 2% that probably are that we haven't identified yet. And so just working with both jurisdictions to see how can we better get services to people so that they're not homeless. And we have been working both north and south with that.
No, and thank you, and I appreciate you're bringing up the opportunity zone piece, because a lot of attention has been paid on other sites that have been named opportunity zones when this was very strategic to have both north and south and the NAMS and the SNAMS campuses designated as opportunity zones that hopefully will attract more or new investment to provide more facilities that will provide more care for those individuals that need it most. And I'm hopeful that there are people out there that have the capital available that will take advantage of this program and invest in those campuses, because there is a significant opportunity there. So again, that's probably a conversation for another day, but I'm glad you brought that up. All right, any other, Madam Secretary, you have any questions? I'm sure you do. I know this is a passion of yours.
Thank you so much, Governor, and I think you've all covered everything. The presentation was wonderful. I was going to ask about the South and how you're working together. Number one, I know SAMs and NAMs, so thank you very much for that coordination and letting me learn that you are working together. The opportunity zones, yes, I understand about those as well. But I want to thank you ladies because you have really taken on a task that is monumental and of Las Vegas as well. You might want to add Henderson and a few of the other areas because unfortunately we have homeless everywhere. And I understand about the dementia portion of it, and I can't even imagine how difficult that population is if their families are not willing to take them in, how we work with them. We lost my mom this year, and she had dementia and Alzheimer's, so it's not an easy disease to deal with. So I commend you all. Governor, thank you for your comments. I'm not going to add any more. You answered my questions, and that was about your coordination with the South. So thank you for that. Thank you, Governor. Thank you, everybody there.
Thank you, Madam Secretary, and I'm very sorry about your loss. I just don't want the moment to go by because this has been a long-standing issue, as I said, for decades. And until now, we really haven't had a site where everybody could agree on, where we had the buildings and the grounds and the resources to bring it all together. So it really is important that we really highlight what's happening here. This is one contract amongst many, but to be able to dedicate that campus, both campuses, north and south, and to provide these individuals and families that need this help, finally, this is a real solution, and it is a permanent solution in terms of giving them that help that they need. So I'm not just saying it when I say thank you and complimenting Ms. Howell and the county and Dr. Kachiver and the state for putting this all together and coming up with a plan and something that is going to be improved, and they're going to get a second chance, as some of the graphics in this presentation show. And I mean, here's a gentleman here who says I was homeless, and he got some services and is back on his feet. But now we're going to have many, many more people that are going to be like him and get those services that they need. Just that little bit of help to get them back to where they want and need to be. So again, thank you very much. Held?
That is correct.
Okay. So do we have somebody from DHHS, Public and Behavioral Health? Oh, Dr. Kachiver, okay. And I asked for this, and I'm not picking on this one, but I just think it requires a little bit more explanation, maybe exclamation too. But in any event, I know this is part of many service contracts, but when you look at it in isolation, $23 million for one individual seems like a lot. I know there's a lot behind that, and I just wanted to give you an opportunity to present that on the record, please.
Sure. For the record, Julie Kachiver. So these are our master service agreements used by the Department of Health and Human Services, and we house them at the Division of Public and Behavioral Health within the department. And we put out 10 scopes of work with a maximum for each scope. For 10 separate activities. We had a number of vendors apply. Some of them applied for 1 or 2 scopes, some applied for all 10. This particular company applied for and qualified for all 10 scopes. And so that's why the contract is a maximum. They could 3 that were selected for all scopes of work, but that doesn't mean that any of them would get any work at all. It's just the maximum.
Thank you. That's all I needed for that item. Madam Secretary, do you have any questions or comments?
None, Governor.
All right. Thank you. If there are no further questions or comments with regard to agenda item number 12, the chair will accept a motion.
Governor, can I ask one question? I'm sorry that we didn't get a response to, and that's contract 39. And we can take this off. They can give it to me with the other, and I know they just didn't have an opportunity to get back. But I was just up money, and I wanted to know if we could just find out how if the responsible party is unwilling or unable to perform the cleanup, how do we assess them or get a feedback from them? Can anybody answer that? And I'm sorry that we just thought we'd get a response back and we didn't get one right away. So I just wanted to ask that question on the record just so they can tell us whether or not that's something that they have in a plan or how they assess and get any money back whatsoever, because that's a lot of money to be given out.
No, thank you, Madam Secretary, and we do have a representative from DCNR with us today.
Oh, thank you, thank you.
Protection. So what this contract is, this is our EMAR contract. It's $7 million split between the two consultants, professional services. What happens is this contract is for events where we need to mobilize quickly. This isn't the normal CERCLA type cleanup that people are probably most familiar with. So this would be something where we need to mobilize quickly, where there's potential receptors being impacted. As part of that process, then we would identify a responsible party and go after them for reimbursement of this money.
And thank you so much, Chef. I appreciate that. I'm just wondering, how is there an NRS? Is there something that gives us the ability to go after them for this fee assessment when they do have a spill or something that needs to be cleaned up? How are you able to make them responsible and put something on the books, so to speak, so that they do have to pay to clean it up?
Again, Jeff Kinder for the record. That's a great question. The authorities in several NRSs spread throughout several of our programs, whether it's air, water, or land. So I can't cite the specific NRS, but there are several NRSs that allow us to pursue responsible parties to get reimbursement.
Okay, if you want to just get those to my office, Scott Anderson's there, my chief of staff. I'd really appreciate it. And Governor, thank you for letting me ask the question.
Thank you, Madam Secretary. And a couple of lives ago, I was the Attorney General, and I assure you we were very aggressive in terms of seeking recovery from responsible parties associated with any type of contamination. And I'm sure the Attorney General's office can be helpful, or the Deputy Attorney General that's signed to DCNR and Environmental Protection can give you those citations.
Great. Thank you, Governor, and thank you, Jeff.
Madam
So, Governor, yes.
You have a motion.
So now, you would like a motion to approve the proposed
contracts presented in agenda item number 12. I second the motion. Any questions or discussion? There are none. All in favor say aye.
Aye.
That motion passes 2-0. We'll move to agenda item number 13, approval of proposed master service agreements. Mr. Nix.
There are 48 master service agreements in agenda item 13 for approval by the board this morning. Master service agreements are statewide contracts that can be utilized by any state agency. The amount associated with the agreement is determined by the type and the number of services that are provided by the contractor. The agreement amount is a not to exceed amount. 4 of these agreements replace existing provider agreements as explained in the June BOE meeting, and no additional information has been requested by any of the members.
And thank you, Mr. Nixon. Just for purposes of the record, there's a couple of these MSAs that have some big numbers next to them. Can you explain that that doesn't mean one vendor is going to receive $80 million?
That is correct. Similar to contract number 23 on the contracts, this is just not to exceed amount. It means that the vendor has applied to provide services. It doesn't mean that they will actually provide any of these services, that they're just authorized to. And so the total amount is a not to exceed amount, and they'll make something between 0 and that amount.
Thank you, Mr. Nix. Madam Secretary, any questions with regard to agenda item number 13?
No, I'd move for approval on item 13, approval of proposed master service agreements.
Thank you, Madam Secretary. Secretary of State has moved for approval of the MSAs presented in agenda item number 13. I second the motion. Any questions or discussion? I hear none. All in favor say aye. Aye.
Aye.
That motion passes 2-0. We'll move to agenda item 14, approval of proposed work plans. Mr. Nix.
There's one work plan for approval by the board this morning. No additional information has been requested by any of the members.
I have no questions. Madam Secretary, any questions?
No questions, Governor. Move for approval of number 14 for proposed work plan.
The Secretary of State has moved to approve the proposed work plan in agenda item number 14. I second the motion. Any questions or discussion? Hear none, all in favor say aye.
Aye.
Aye. That motion passes 2-0. We'll move to agenda item 15, the information item. Mr. Nix.
There were 67 contracts under the $50,000 threshold approved by the clerk between September 18th, 2018 and October 22nd, 2018. This item is informational only. No additional information has been requested by any of the members.
Any questions, Madam Secretary?
Not at this time, no. Thank you, Governor.
This is an information item and not an action
Yep.
item, so we'll move to agenda item 16, which are reports from the DMV and the Governor's Finance Office. Mr. Nix.
16 is an informational report on the available balances of various contingency accounts managed by the Board of Examiners or the Interim Finance Committee. As of October 19th, 2018, these accounts will cover the contingencies through the 2017-2019 biennium, and I would be happy to answer any of the questions the board may have. Of motor vehicles, this is the collection for the period between July 1st, 2018 and ending September 30th, 2018, and that's information item A.
Thank you, Mr. Nix. My only question.
$7 million left after the approved contingency request from this meeting. We have requested that all agencies submit their contingency request for this biennium for the December BOE meeting. And at that point, we'll know what our residual balance is. At this point, we are anticipating that the majority of the fund will be used by the agencies, and that should get the agencies to the point of being able to request a supplemental through the legislative session.
No, and thank you, and that's the point I wanted to make on the record, is that we're not in any difficult situation, because in the event we do use this money with the legislative session coming up, they'll be able to make an appropriation for that fund. All right, Madam Secretary, any questions with regard to agenda item 16?
None, Governor. Thank you.
Okay, we'll move to agenda item number 17, public comment. Is there any member of the public present in Las Vegas that would like to provide public comment to the board?
None, Governor.
Anyone present in Carson City that would like to provide public comment to the board? I hear and see no one. I just wanted to say, Madam Secretary, congratulations on your reelection, and thank you for your service to the state and your continued service for the next 4 years.
Governor, thank you very much for that, and I want to thank you for your 8 years of service, and what a pleasure it's been to not only serve with you in 1997, but as governor, and it's been a real pleasure for me. I'm sorry you're not going to be here for the next 4, but look forward to working with you outside, whatever it is you decide to do. All right. But thank you.
Thank you, Madam Secretary. We'll move to agenda item number 18, adjournment. Is there a motion to adjourn?
Yes, I'll make the motion to adjourn.
I'll second the motion. All in favor say aye.
Aye.
Aye. Everyone have a happy Thanksgiving. And
Happy Thanksgiving.
Enjoy that
Yep.
holiday. Thank you very much. This meeting is adjourned.
Thank you.